Hello, everybody. Thank you for joining us this afternoon for our Why You Should Build a Relationship with Your PCP or your primary care physician. I'm Carla Cosillo. I'm one of the wellness coordinators in our health promotion and wellness department here at Florida Healthcare Plans. Okay, so now I'd like to introduce our speaker for today. We have Matt Hoffman. He's a PA or a physician assistant. He has his master's in medical science from Arcadia University, and he has over 20 years of experience in this field. He's worked at Johns Hopkins Hospital, Halifax Medical Center, and right now he's working here at Florida Healthcare Plans. His specialty include emergency medicine, neurosurgery, occupational medicine, and urgent care. Right. So Matt has a lot of experience, and he's happy to share some reasons why we should have a relationship with our primary care physician. I will turn it over to you, Matt.
Thanks, Carla. I appreciate it. And thank you, everybody, for coming in today and joining the webinar. This is really kind of a fun topic because it's not one that really gets talked about all that much. A lot of people just kind of assume that, you get a PCP. A lot of people don't get a PCP. Oftentimes I see a lot of patients through our urgent care centers that, are in their 20s, 30s, maybe even 40s. And because they feel like they are always healthy and never get sick, they don't need a primary care physician. But today's presentation, I'll show you why it's important that you do. The main reason, obviously, that we want to develop a strong relationship with our primary care physician is because it will benefit you, the patient, to have better disease control and improvements in overall health. So I'm going to go over 10 key reasons why that is. So number one, your primary care physician holds key resources for your healthcare needs. They've got connections to other medical needs and information that can be very vital to your well-being, both in the near future and distant future. These connections oftentimes are ones that, require someone to be your advocate so that you can be seen in a timely manner if there's an issue going on that requires really quick, immediate action that you wouldn't necessarily have if you didn't have a primary care doctor to be your advocate. So number two, knowledge of your past medical history. This one is super important because, as we get older, we have a tendency to start racking up the problems. And your primary care doctor will really have a great picture of who you are with medical issues and what is priority in those medical issues. And so when you are being seen, oftentimes your primary care physician can utilize those knowledge of the past medical history to help them create treatment plans. It also allows them to follow your health trends to make better treatment decisions. So, for instance, as we get a little bit older in life, sometimes we develop things like high blood pressure, diabetes, a slew of other things. And when you go into your annual visits with your PCP, they can see trends with those numbers. Whereas if you just go to an urgent care or an emergency room every so often when you get sick, to them, you may have a high blood pressure reading and they don't think anything of it. They think, oh, you're sick or, oh, you're dehydrated. Don't worry about it. Just drink more fluid. You'll be fine. Whereas there could be a real problem going on. Unless you have a primary care physician, that problem is not going to be addressed adequately in order to help prevent long-term issues of your health. So number three, a trusted contact to call when you're not feeling well. Oftentimes when you're not feeling well, you're stressed out about that. And it's very difficult to know where to go, who to see. And your primary care doctor can oftentimes be the gatekeeper to help you make those decisions. Oftentimes, your PCP is going to know you quite well if you've been there every year or multiple times a year, and they'll know if you're someone who tends to get bacterial sinusitis more frequently than somebody else, or a bacterial bronchitis more frequently due to anatomical things. So they're super important to be able to be the first contact for you. They can help you decide, okay, can I should I go to the emergency room, or should I go to an urgent care, or can my primary care doctor fit me in or squeeze me in to see me real quick? Oftentimes now, because of what COVID has done, which is one of the good things that's come out of this, is that a lot of doctors are doing more telehealth visits, where they can at least lay eyes on the person and get a kind of sense of, are they really in danger right now, or is this something that we can manage as an outpatient? And oftentimes they're very easily accessible. They may not necessarily be able to take your call immediately when you do call, but for the most part, they'll get back to you by the end of the day and give you some guidance as to what to do, or at least what to watch for. So advocacy is really important. We talk about that in a lot of different facets when it comes to healthcare. And your primary care doctor can definitely be a major advocate for you. They will help you to establish future goals. They can help with current health concerns, and very instrumental in managing care plans when specialists are involved. So as we talked about before, your primary care doctor is the one that really gets to know you well. And so if you've got an issue going on that does require a specialist to get involved, they can oftentimes orchestrate and organize, you getting to those specialists in a timely fashion. And if you have to go to multiple specialists, oftentimes they are there to be able to prioritize, who you need to go to first, and then how to manage whatever condition you've been sent there for. Oftentimes too, future goals are important. So, there are things that kind of creep up on us, right? So genetics play a role, aging plays a role, our own dietary, health plays a role, our habits. And, when you're looking to do things like, get a little bit of weight loss, or get a little bit better sugar control, or control cholesterol levels, your primary care doctor is the one that can really advocate to help you develop those plans and kind of make you be more grounded in terms of ensuring that you reach the goals that you're setting out for. Next, we have early detection of health issues. And this is a pretty big one because, technological advances now allows us to detect things much sooner than we ever have before. And not just that, but we also have a lot of treatments now for early detection, so that where previously certain things may have led to bad outcomes, now when they're caught early, they lead to very good outcomes. A couple of things that come to mind are for males, prostate cancer is something that becomes very relevant as men hit their 40s, 50s, 60s, and 70s. And, we have testing now available to us that a lot of primary care doctors will order called the PSA, which is a prostate specific antigen. And, that will help them detect, early rises that could essentially be the start of a prostate cancer. Likewise, in females, mammography has gotten very advanced. They've got diagnostic mammograms now, and they can detect very small, areas of abnormalities. Breast cancer, is one of the cancers that is very treatable in early stages. So these are just two examples of many things that we have that if detected early can really be helpful. And going to your physician annually, they kind of help to organize these things that we may forget about or not realize, or even possibilities. Colon cancer is another big one that I forgot to mention, that it used to be that colonoscopy was the only way to find that, but now they've got things like Cologuard, which can pick up genetic material that can look for cancer. And if you can catch colon cancer early, it's very curable. So, and it's also very fatal if you don't. So I always try to educate patients the importance of seeing their primary care doctor because prevention is really key. Next is improved management of chronic diseases. So As I kind of alluded to before, as we get a little bit older in life, we have a tendency to pick up some problems that we didn't have when we were younger. And unfortunately, this is kind of the nature of the beast. And, high blood pressure, diabetes, obviously the two big ones, that we talk about a lot. But there's other chronic diseases that people have that require really close management. Things like inflammatory bowel conditions, Crohn's disease, ulcerative colitis, COPD, asthma, all those conditions are ones that really require a physician, preferably primary care physician, to manage those closely so that you have, good outcomes. Oftentimes these conditions, when they are managed well, they will not cause significant issues during your lifetime. But when they're not managed well, they can cause a lot of problems. Specifically, let's take diabetes for an example. Diabetes that's out of control or not well managed, can lead to retinopathy, which can lead to blindness. It can lead to cardiomyopathy, which can lead to heart attacks and strokes. It can lead to nephropathy, which is your kidneys. It could lead to kidney failure. But if you have someone that you can count on, like your primary care physician, that you can go to, every year or even multiple times a year to manage these conditions with medications or diet or some sort of a treatment plan, many of those people will never see the complications that can come with these diseases because they're well controlled and they really take part in their own healthcare. So next up, number 7, we have referrals to other medical specialists. This is important because we all know how difficult it can be sometimes to get in to see a specialist. The referral can be made and, you may not hear anything for, weeks on end. But your primary care doctor, being your advocate, if you're not, getting the treatment that they feel that you need, have the ability to kind of coordinate and advocate for you, potentially even doing doctor to doctor type phone calls to say, hey, listen, I've got this patient, I'm concerned about them. I really want to get them in much sooner. And so that communication with specialists can really help to develop these treatments and ensure that they're being followed. I mentioned before that, the primary care doctor, one of their purposes is to kind of have that big picture of you. And, you can kind of see over the years how it can confound if somebody has, asthma or COPD, they might need to see a pulmonologist. But then on the flip side of that, they've got a strong family history of cardiac disease and have been having some chest pain. And so before you know it, they're seeing cardiology, pulmonology, and your primary care doctor really is the one that has that, 30,000 foot level view on everything to make sure that, that all treatment plans are moving in the right direction and are copacetic for, the outcomes that we're looking for. So number 8, decrease in hospital and ER visits. This is interesting in the sense that there are some studies out there, and I'm just highlighting one specific one, but basically showing that with a primary care physician intervention / collaboration, there is a known reduction of emergency room visits and hospitalizations. That number is substantial, as you can see, 49 visits down to 7 visits when there's a primary care physician involved per 1,000 patients. Now, the reason for this has a lot to do with the fact that the primary care physician, again, can use their own network within their realm, such as specialists or even just them monitoring patients very closely daily to ensure that they're getting the care they need as an outpatient. We don't like to have patients to have to go to the emergency room if we don't have to, especially when we think or feel that the condition that they're currently in, could be treated as an outpatient. And there's a lot of reasons why we don't want patients in the ER. One of them being, with all the diseases out there like COVID and flu that are highly infectious, the last thing we want is for one of our patients to go to an emergency room with abdominal pain and end up coming home with the flu or COVID. So it's really one of those things that I think there's been a real push recently to have a lot more coordination and collaboration. Your primary care physician, like I said, should really be the first person that you call when something is going on. They're really good at triaging patients and having a good understanding, again, if they know you well, if it's something that they should manage, something an urgent care should manage, or if it does indeed require an emergency room visit. But, keeping patients out of the ER, it can be done successfully when you have a primary care physician that you can, help guide you. Number 9, medication management. This one can be extremely helpful to have a PCP on board helping you. Medications, no one likes to be on them, unless they have to be, of course, but there can be a lot of drug-to-drug interactions or reactions, and your primary care physician is going to know this best. Kind of alluding back to a lot of the things we've already discussed, if a patient has multiple conditions and they are on multiple medications, one specialist may not necessarily be privy to the fact that you're also taking, a blood pressure medication that may interact with, a steroid that they're going to put you on for your lungs. But your primary care doctor, has that information. They know you well, and, they'll be able to ensure that you have a good medication safety profile that's not going to put you in danger. In addition, they'll ensure that you don't run out of your medication. Oftentimes we see situations where, especially at the end of the year, if somebody's losing their insurance and they did not get in to see their doctor before the year ended, they run out of medication. And, that can be a really big issue, especially when you're talking about, illnesses such as diabetes and high blood pressure, because again, going uncontrolled can really cause significant problems for patients. And so just the medication management aspect itself can really keep patients in a stable position with their chronic illnesses. And really that's managed best with, primary care physicians. Lastly, number 10, this is a bit of a no-brainer, right? Peace of mind. Especially in this complex medical environment that we're in, just knowing that you have somebody that you can call on that can help guide you, sometimes is the best medicine you could ever get. So having the right PCP is definitely the solution to understanding how to get through this complex system. It's like I said, you can call your PCP at any time. You don't have to have an appointment necessarily, but they'll help guide you. Their staff will help guide you. Primary care doctors have a lot of great medical staff in their offices, including medical assistants and nurses and LPNs, and all of which have a wealth of knowledge that oftentimes can be communicated through the primary care doctor. So it's really important to be able to do that. So here's a few little bullet points on how to build a good relationship, with your primary care physician. So obviously it's got to be built on communication. You've got to be able to have a good rapport with your primary care physician, and then eventually develop, trust that their guidance is one that you also agree with. And of course, respect and honesty between both parties. It's important to find the right doctor for you, someone that fits your personality and communication style. And, don't hesitate, if you just don't feel like you are jiving well with your primary care physician to find another one. Believe me, it doesn't hurt anyone's feelings, because at the end of the day, we're all here to help patients. We want to make sure that patients have the resources that they need, that they're comfortable with, that they can have a successful, health experience. And so, it's very important that, you're with a primary care physician that you feel open and comfortable with. Honesty is very important when you're talking with your doctor. And oftentimes, throughout our lifetime, there can be a lot of very uncomfortable positions that you find yourself in, and topics that may be taboo. And it's important that you have a rapport with a primary care physician, that those topics are not as difficult to discuss. So, that being said, it's also important that you go to your doctor at regular intervals, because that's how you build that relationship. Seeing your primary care doctor, once a year, which is what a lot of us do, can help you build that rapport. But as you start to develop other issues and need more frequent follow-up, you want to make sure that you're with a physician that you are really comfortable with. And then that leads to asking questions if you do not understand. It's important to know that a lot of primary care physicians and providers really do care that you understand what is being told to you. There have been some studies out there that suggest that patients only retain about 10% of what they're told during their doctor visit. So, if you need the physician to slow down or back up or describe a terminology that they're using more clearly, by all means, have them do that. You're more apt to remember what it is when you get a good explanation of it and when you have a better understanding of what it is than if the doctor just kind of continues on their normal course or tangent, if you will, of that medical condition. It's one thing that it's interesting is that, perspective wise, we have a tendency to ramble on all these medical terms. We just spit them out, without even thinking, because we do it all day long. But not realizing, unfortunately, to the patient that these are terms that they've never heard before. Oftentimes probably don't even, know how to spell with as quickly as half of us talk. So, it's really important that you ask the doctor, slow down, or please explain this in a little bit more detail, because that's very, very important that you understand it. In addition, if you've got concerns about your treatment recommendation, have that open, honest communication with your primary care physician to say, I don't know if I really agree with this. Can you explain this further? Or, I oftentimes have patients tell me, well, I had a friend that did this and it didn't work for them. And, I'm happy to hear that, because it gives me an opportunity to talk about maybe why that didn't work for them, and why it would probably work for you. And so, it's definitely an opportunity to be able to sit down and have a really good conversation with your primary care physician. And then also, on the patient side, be willing to work towards changes to improve your health. It's important that that everyone is involved in long-term healthcare. It's the primary care physician, it's the patient, it's all the support staff. Everyone wants to make sure that their patients are doing well, and the way that happens is by having a patient that's engaged in their health, that is open to doing different interventions that could overall improve health. So just being open to that, but all in all, I'd say that, I think that having a primary care physician is really one of the best things you could ever do for yourself. That doctor oftentimes becomes kind of part of the family, when you're seeing them frequently, if you need to. And it also gives you someone, like I said before, you can really bounce things off of, just to get guidance as to what to do, where to go, and just give you better sense of understanding of your overall health, but helps guide you in the right way.
Thank you, Matt, for all that wonderful information.
You're welcome.
Now, I do have, if you don't have a PCP, or maybe you're looking for a new PCP, I have a short video that I'm going to share with you. One of the things you need to determine is what network you're in. And these are the more common ones: the individual, family, or employer HMO, PSO, or the triple option. And during the video, you'll see where that comes into play.
Finding an FHCP provider or facility is easy. To get started, you'll need to log into your member portal on FHCP.com. Just go to Portal Login and select Member Login. Now enter your username and password. Once in your account, go to My Benefit Plan and choose Consumer Provider Search at the bottom of the drop-down menu. This is your provider directory. Here you will have two options. If you already know the provider you're looking for, enter their name in the search box. Your other option is to search for a provider by using the filters. First, you will need to find a provider who accepts your insurance plan. To do this, go to Search by Product Network and choose your plan from the drop-down menu. Next, enter your zip code or county. Now choose the type of provider you're looking for and click Search Providers. Let's talk about your search results. This section shows the total number of providers and facilities based on your search. If you'd like to narrow it down, choose Advanced Search. Here you can make simple changes to help find exactly what you're looking for. To learn more about the provider you've chosen, click on their name. Details provides contact information and specifics about the provider and their practice. Provider Network shows the insurance networks that the provider participates in. And Locations displays a map and the locations where the provider practices. And that's it. If you'd like to start your search over, click Start New Search. If at any time you need additional assistance, please contact Member Services. We are here to help you.
All right, so that was just a quick video showing you how you can look for a PCP. At a later point, you want some more information, you can contact us at wellness@fhcp.com. We thank you very much for joining us this afternoon, and thank you, Matt, for the wonderful information.
You're welcome. Thank you, everybody. I really appreciate it.